Hi guys, welcome to my YouTube channel. If you are new here, you're welcome. My name is Onyinye and this is my YouTube channel. You're welcome to hit the subscribe button if you like the sort of content that I create. I create beauty, lifestyle, content about things that I like in the hopes that you like it as well. So just look around. If you're comfortable here, go ahead and hit the subscribe button. And to all my returning subscribers, thank you guys so much. I cannot express in words how grateful I am for you guys. Thank you for coming back, for subscribing, for watching my videos, for leaving comments. I really appreciate every single one of you. Thank you, thank you, thank you. Today's video is going to be a pregnancy update video, and as you can see, I'm very happy filming this video today. I am officially 37 weeks pregnant, and God, am I glad, like am I grateful, am I thankful? Like I cannot say how I'm feeling because you guys already know like the backstory. So to be here filming this video, giving you guys an update on how my journey has gone so far is incredible. A beautiful thing, and I'm really grateful to God that I am here. I'm hoping that the rest of the journey continues to be smooth. Like I promised in the last video, I'll be filling you guys in on what has happened since the last update video, and also telling you what my plan for the rest of the journey is, disclosing my birth plan and everything. At this point, I'm knowledgeable enough to know that everything will not go as planned, but I'm taking like a slightly different route with my birth plan, so that's what I'm just going to share in this video. The outcome of all of that is up to God. So starting with the update, since the last time you saw me, what has been happening? Yeah, first of all, the very obvious one is that I popped. Like the girl blew up. My tummy leads the way. I cannot deny that I am pregnant. Like it's there. It's really there. I did not believe that my bump was going to grow this big, because up until I was 7 months pregnant, it was still hideable. Now nothing works. Like nothing works. So I've just accepted it the way it is and just pushing forward. So yeah, I blew up. I've added a lot of weight. Thankfully, on the scale is not as dramatic as I'm seeing myself physically. I wouldn't say that I was in the healthiest of space weight wise before I got pregnant. So on the scale, my weight hasn't changed that much, but physically I can see that I've added a lot of weight, especially like my bump obviously, and I can feel the weight as well, which is the annoying part of the whole thing. Every single kg that I'm carrying I can feel. The second update is that everything hurts because of the change in my size, the change in my bump, the change in my spine, posture. Everything hurts and it's difficult to do anything. Sit down, stand up, lie down, sleeping. Oh my God, sleeping has become a task. And at this stage of pregnancy, you're advised not to sleep like on your back, so you have to do your sides, either the left or the right side. And if I tell you that my hips have given up, they have given up. Like at this point, I'm sitting down to sleep. Like I start on my left side when I go to bed. I lie down like that for a bit. My hip on that side start hurting me. I switch over to my right side. I lie for a bit. It start acting funny. I just sit up, just prop pillow behind my back, draw my blanket close and just sleep. That's the way that I've been sleeping these days. It's not so uncomfortable, so I just prefer that to the pain of moving. And the pain is not just like on your hips, like the process of moving from one side to the other is also painful. So instead of disrupting my sleep, I just sit down to sleep. Another difficulty that has come with sleeping is also peeing a lot. So the best option for me is just to sit down. As often as I go to pee, it's easier to come down from the bed sitting down. So that's the position that I've chosen. I've chosen my struggle. Yeah. The next thing that I was going to share is that Braxton Hicks is kicking my ass. Like That thing is the most scariest thing that I've experienced in this pregnancy, I think. Oh no, the second scariest thing. I'm going to share the first one very soon. So before I got pregnant, or even with my pregnancy experience, I knew that at a point I would start experiencing Braxton Hicks. What I did not know is that they can be long. So I was thinking I was just going to be something that happened a few times a day for like a few seconds, those times that it happened. But I've been having episodes of it happening for hours, especially at night. There was one episode that happened for like 4 or 5 hours straight. I was just so anxious and scared that I was going to go into labor, because it just kept happening. It kept happening and just kept happening. And at that point, I had not registered at a clinic here. I'm currently in Canada, so I had not registered at a clinic, so I didn't even have any doctor's number or contacts to call. So it was just so scary. I had to look up what was happening to me on the internet, and it was not a good experience at all. So to prevent that sort of long episode happening, I have read that drinking water helps. So I have been drinking a ton of water. It hasn't helped to stop the Braxton Hicks. It still happens very often, but I've not had like an episode like I had that time where it happened for like 4 or 5 hours straight. It just happens a couple of times a day, which I think is normal, and which the doctor I have now agrees that is normal. So I've just been managing that. Thankfully, it's not a very painful experience. It's just crampy. I've had really bad cramps, so there are levels of pain, discomfort that I can endure, and this one is included in that bracket. Another thing that I've been dealing with is anxiety. As I was approaching the end of my second trimester, beginning of the third one, I started getting very anxious, because it was around that time that I had the premature rupture of membrane the last time. So around that time, this time around, it was very difficult for me, especially mentally. So every single symptoms that happen with my body associates it with, my head, not my body, associates it with something repeating again. So anxiety is one thing that I've been dealing with big time. I'm just scared that at this point anything can happen. I can say that it is even now that I am full term that I have sort of calmed down a bit, knowing that at this point, if anything were to happen, my baby is fine, I will be fine by God's grace, and everything is going to, go well. They are not going to be premature or considered premature like the last one. So up until now, my mind has just been hanging in the air. So I dealt with that for as long as that period lasted. Thankfully, we are 37 weeks now, and I'm just so happy that I am at this point, that we got to this point, and that everything has been fine. Like, given my last experience, I could not have asked for a smoother ride. This pregnancy has just been very uneventful, like very boring and uninteresting, which is amazing. Like, I'm hoping that it will continue to be like that till the end. I've also been experiencing fatigue. Like, I am tired 24/7. I have shortness of breath. I have difficulty walking long distance. Sometimes I just get very tired, and I think that is normal at this stage. We are just counting down to the end, and there are normal symptoms that I am gladly embracing. If my body doesn't feel like it, I don't force myself to do things I'm not capable of doing. Some days I wake up and I just want to sleep. Like, I wake up and I want to go back to sleep, and I do that instead of pushing myself to do what I know my body is saying it doesn't want to do. Sometimes I sit down when I have to do things that I need to do. I sit down to do them, or find comfortable position to do them, as opposed to like stressing myself. So I would say that I've been listening to my body lately and just going by the way that I feel. I think that's all of the things that have been happening. Like I said, it has been quite an uneventful journey, which I am grateful for. So not a lot of things are happening. Everything that's happening I will consider good, and I just cannot wait to have my baby out healthy and nice. Now to the second part of the video, which is the plan that I have for birth. I have chosen to do an elective C-section. I don't know if chosen is the right word to use, but I think that that's like the best option that I have given my history, my medical history. So I have had previous abdominal surgery, and with that I was told, even when I had the surgery, during the whole consultation period, that going forward my option with giving birth would be CS. So chosen may not be the right word to use, but that's the route that we are going. So right now we have a date picked already, and I don't even know how I feel about it. I'm anxious, but I'm also excited. So usually when you opt for an elective C-section, they do it at the 39th week, but I have chosen to go like a different route and do the 38th week instead, because I don't want to go into labor. The last time I was in labor, I didn't even know that I was in labor. So this time around I'm choosing not to go into labor or take that risk of pushing to 39 weeks and then going into labor and having emergency C-section. Like I don't want that, because with my previous abdominal surgery history, there's like the fear of your uterus rupturing in the process of labor. The uterus doing that expanding and contracting thing. With that, there's the risk of it rupturing because you've had it operated on before. So they usually advise that you do elective C-section. So me, I'm so scared of going into labor and having to deal with the fear of that and then trying to give birth vaginally. So like I have just chosen to do a week earlier. Hopefully I don't go into labor before the date we chose. So that's it. On that day I'm just going to roll into the hospital and have my baby. So that's the plan that we are going with. Right now I'm not even prepared for that at all. I've not packed my hospital bag, I've not done hospital tour, I don't even know where the hospital is. So there are a lot of things I need to do in preparation for that, but I think that I am at peace with that decision. Not I think, I know that I am at peace with that decision, even though there are a few risks associated with it. I think that I'm comfortable with it. I've had both experiences. So I had a vaginal birth the last time, and I also had like a surgery that is similar to a cesarean session. So I know what the two recovery process is, which I am glad that I do, because I'm a kind of person that would overthink everything. So knowing what recovery is going to be like, I know that it's not going to be exactly the same thing, but I've recovered from that sort of surgery before, so I know what to expect with that. So I'm really happy that I do. So hopefully everything goes as planned. There's a fear of the baby having wet lungs when they are delivered, but I'm hoping, I'm praying that that is not our case, and if it is, God forbid, they will be treated by God's grace and everything will come out fine. But I'm hoping that we don't have to deal with that, given that we are where we are. Yeah, so that's it. I feel like I've been talking for too long. Oh God. Yeah, I feel like I've been talking and rambling for too long. Hopefully you guys understand what I'm saying. If you have any questions about all of the things that I've said, let me know in the comment section. If you are a pregnant mom who has like a similar bed plan, or I don't know, if you just have any questions, let me know in the comment section and I would definitely respond. Yeah, that's it for this video, guys. If you've watched up to this point, you definitely like what I'm talking about. You like seeing my face, you are learning something and getting value from what I'm sharing. So just go ahead and hit the subscribe button, share this to someone who you think would benefit from it. I'll be really grateful for that. So subscribe to my channel, and I'll see you in my next video.